We have 7 senses that help us gather information to live in this world. Sometimes children have problems with sensory processing, which can cause learning disabilities. We spoke to occupational therapist Melina Rodriguez at Children's Hospital of Orange County and asked her to explain sensory strategies to help these kids function.
So if we look at our sensory integration system, which is basically looking at all the different sensations that we have our sense of taste, our sense of smell, our sense of vision, our auditory sense, but we also have 2 other sensations that we're not quite as aware about, which is our vestibular sense and our proprioceptive sense. Our vestibular sense is actually in our inner ear, and what it does is every time our head position moves, it gives us information to know exactly what our body is doing. Our proprioceptive sense is in our muscles and our joints. So every time I move my arm, I'm able to tell exactly what this arm is doing and imitate it, say, on the opposite side. So that whole sensory integration is being able to take all of those senses, integrate it together to make sense of our world, and so that we can react or take action accordingly. The importance is for us to be able to function independently and appropriately to what we have to do in our life. As an example, just even being able to put a shirt on and knowing which way that shirt goes, or being able to put buttons on. We have to be able to feel that correctly in order to be able to know how to respond. So the same thing happens if we have problems in these areas, then that is where the big concern happens, because we might not be able to go up the stairs, we might not be able to notice safety within the neighborhood, we might not be able to notice, say, the fire truck that's passing by and which direction that fire truck is coming from. Tags might bother us, sounds, touch, and so when it becomes such a big concern, you're only able to focus on those and not able to focus on other things that are really relevant. When a child has difficulty with these systems, you'll notice that a lot of times they're having difficulty functioning independently. So they might show behaviors, avoidance behaviors or negative behaviors. It could be screaming, it could be hitting, biting. If that intensity of that input, such as, say, maybe a baby's crying, and that sound is so kind of hurtful almost to that child, that they might lash out, as an example, because they don't know how to calm their system down in order to be able to tune that out.
We asked Melina Rodriguez to give us some examples of children with sensory problems.
This is probably pretty typical of a child with sensory concerns. You might see that they're walking outside and all of a sudden there's some grass and they don't want to walk on the grass, they walk on the sidewalk. Because that stimulus is too much, you see them now standing up on their tippy toes and they're walking and you see their body start to tense. And so now they're walking and all of a sudden their whole body is just extremely tense because of the stimulus around them. It could be the noise on the street, it could be somebody that touched them really lightly, and it's just hard to kind of make sense of that. The hard part about sensory integration is it's a continuum. So you have kids that are really overly sensitive to things, and you have the child who's under sensitive to things. And so within that, usually an average person will just vary throughout the day through that. But with children with these concerns, they either have, such an example with food, they will either avoid certain foods or eat an intense amount of certain types of foods and not others.
What advice do you have for parents in regards to a child with sensory problems?
Your sensory system is constantly growing, so as a child it's really important to incorporate lots of different various multisensory activities is what we call it. So just being able to do more with your overall body is helping that sensory system organize and integrate and kind of figure out what to do with itself. Activities, again, that incorporate the whole body, stuff that uses your muscles. It could be, riding your bike, it could be pulling a wagon, helping out with the laundry, pushing the laundry basket, helping out with the groceries. It could be playing with Play-Doh, clay, getting messy with food, just kind of enjoying all of those sensations that the world really has to offer.
If you suspect your child is having difficulty with sensory problems and you have tried various strategies without success, consult an occupational therapist for further evaluation of your child's sensory needs. For the American Health Journal, I'm Laura Windsor.